I'm here with my dad, Poppy. The kids call you Poppy.
Poppy, yeah.
We were just talking about he's gonna get a knee replacement. So we're just pulling up right now for his pre-op,
Right.
with Dr. Adam Wright. So, you excited? Are you nervous?
Yeah. Yeah. No, I haven't been cut before,
Yeah.
so this is new.
This dude, yeah. No, I remember you said when we were kids you had the scope done,
The
right?
scope, done. That wasn't.
Yeah.
That was very minimal. But yeah, then again, it wasn't very therapeutic.
Yeah, and I know you said because now you got grandkids. I got two
Yes,
little boys, so
yes.
we were talking about getting this done because he's
Right.
playing soccer and now he
Right,
can
right.
move around.
I can
so
move around
it's
more.
gonna be cool.
Yeah.
Yeah, it's gonna
Wonderful,
be neat.
wonderful.
That's sweet. Well, let's just head in there and let's do the pre-op.
Okay.
And, go through the runs and everything. So
Good.
Let's have some fun.
And so 2 weeks after the 12th, I'm looking at the 27th of December. It's a Friday, right after Christmas. Does that work for you?
That works too.
Okay, yeah. You want to do morning or afternoon?
So we actually ran into a hiccup. Insurance didn't approve his surgery until February 11th, which is a whole 2 months later. But that happens. It's not uncommon. Insurance sometimes rules the world. So we didn't get surgery till February.
Medications. There's going to be a lot of medications, so you may feel overwhelmed, okay? But everything in this packet here. And then we'll kind of talk about how to take care of it, okay? After I'm done, the brace department will come by and get you for a couple things, okay? And we'll get into that. And then Dr. Wright will come in to answer any questions that you have that I can answer, or sometimes when I leave, you guys think of something else, okay? All right, so first things first, we got your labs today, is that correct?
Yes.
Okay. And you had your heart looked at too, is that
Yes.
correct? Okay. And it gives it to the Mako robot. Okay, so that robot, makes some 3D model of your knee, so we know what to do with it, right? This right here is cobalt chrome that goes on your femur up here. Okay, and this is titanium. It goes into your tibia down here. This plastic piece right here is called polyethylene. It's like a plastic, right? It goes in between these two and kind of creates that joint line for you. Okay, that's what it is. There's a patella in the front there. We just don't have a model of it. So typically what we do is we shave down the patella and we put like a plastic piece behind it, and so it'll be on top of this. Okay, you won't be able to see the plastic part on the X-ray because they're plastic. But if anything's gonna wear out, it's gonna be this plastic piece. Okay, so the harder you use your knee, the faster it'll wear out, right? So and I was saying about the clicking, right? So you can have some clicking after. That's because of the mechanical device, right? So, but yeah, that's mostly what your knee will look like. Okay.
So these are
just like to kind of keep the model together. Yeah.
Okay.
Infection, bleeding, blood clots,
yeah.
Those are all risks. We take them all very seriously.
Yeah.
Infections are pretty rare, blood clots pretty rare, but data says probably about 1% of surgeries. My rates are less than that, but we do a lot to prevent them, so we really care about that.
That's good.
Stiffness, that's a real thing we work on. This is not the knee that God gave you. This is an imitation. As try as much as we can to imitate the real thing is not that. But it works pretty well for all things you usually need to do. It's never going to bend back as much as a normal knee does. It's never fun to kneel on these things. You can do it, but it feels weird. Whenever you have a scar in the front of the knee, the whole knee nerves get remapped a little bit, so it feels a little different. But those are the natural limitations of knee replacement.
Right.
If your bone feels good during surgery, and I like the way that everything fits, I'll use what's called a press fit implant, which means that quite literally, I hammer these pieces into your bone, and your bone grows into it.
Okay.
Which could mean that it lasts you the rest of your life. And these are sort of newer in implementation that we've been using. And, the data on them is pretty good. And it might mean that you have a little more soreness in the beginning, you know, as everything grows in, but if it lasts you forever, that's what I'd like to do.
Good.
There are several different types of the knee replacements too. This one's what we call PS knee, which means that your PCL is sacrificed. A lot of times your PCL is already not there. And a knee that's as bad as yours, that may already be the case.
Right.
I don't typically use this device because it clicks just a little more. However, if you need it, I have everything there available to me.
Okay.
So we'll just take a look and see what it needs. I have all the options that we need in the room, you know.
Once you're there, yeah.
Once I'm there. Questions for me on the surgery or rehab or anything?
Yeah. Well, first of all, why do you put people on that stress test? You know, that thing was. Do you look at the age of the person to determine how much you want to push them?
Yeah, I want to make sure that when you're under the stress of surgery, that you're not going to have a heart attack, or anything else. And a lot of my older patients, they already see a cardiologist, so they've already been through that.
Oh, okay.
So you were in the unique group that you were pretty healthy.
My goodness.
But I'm assuming you're healthy, and I don't want to find out during the surgery that you're actually not. I've had quite a few patients too, actually, where several every year where they do something like that, and then we find out you actually need bypass surgery before you get your knee replaced.
Interesting.
That's crazy.
That's never a fun thing to tell somebody, and to find that out.
Yeah,
however, it's way better to find that out before it gets than during knee replacement.
Yeah, that's why.
That's amazing.
I was just wondering about.
I guess consider yourself lucky you were in the healthy group. It's a lot of work to do. So
I mean, I was okay.
Yeah.
I was thinking about the other people. That's the way
sometimes people just can't do it.
Wow.
Yeah, but it's good. It's
But
good stuff.
a lot of times, like my older, more sickly patients, they have already had that done or a chemical stress test because their heart's not healthy to begin with. So that's strictly for my healthier folks.
Yeah. No, it's good. It's good stuff. It's good stuff. I like that. As far as the cutting, I recovered that because some people cut real deep, but they explained it that
The Mako machine.
Yeah.
Kind of guides you, and then you don't have to worry about too much hematoma.
I have videos of me doing this on the internet, if you want to see, actual surgery videos. I actually recommend you not watch it.
No.
Charles has been in there seen it. But I was telling him this earlier, like my dad was the type of guy that he would send me videos before he got his knee done. Like,
wow.
Is this what you do? Is this how it is? And when he was researching getting his knees done, so he wanted to know everything.
He wanted to know everything.
He wanted to see everything. And you're either that type of person, or you're the type that says, "Doc, just tell me it. Wait, don't tell me anything else." So I'll tell you as much or as little as you want to know.
Yeah. No, it's good. It's good stuff. No, I'm really happy.
Yeah.
I was telling him I've just never been cut before, so this was
kind of unusual.
It's a little fear factor, but then again, from what I see, there's confidence. I'm trusting you guys.
Well, I'm honored. All you have to do is take a nap.
There you go.
And nobody's beat the anesthesia yet. I guess you don't technically have to take a nap. We can just give you a spinal tap. You're supposed to mid out.
We hope you're enjoying this YouTube series on Poppy's surgery journey. Please remember to like and subscribe, and see you on the next video. God bless.